degrees of shoulder abduction, or sorry, shoulder flexion, I should say. We'll take them to about a 90-90 position, and then we may bring them back to a little bit of external rotation. So all we're going to do is say, listen, I want you to engage your core, and then don't even move it. Resist me. Pick it up. Okay. Okay. We'll do a couple there. And this is good feedback for me, too, because I can tell our guys' tough strength's improving over the course of an off-season. You'll see a lot of guys that just in a matter of 3 or 4 weeks, it improves dramatically. We'll lay our arm back. Okay, don't move it. Pick it up. So they're usually the weakest. So for you, you probably want to be, so you're kind of cranking with your biceps. Stay right up there. Don't move. Stay right up here. Good. So, I mean, you can do ball to wall. You can do 2 positions. You can do rhythmic stabilization with the band and the rack, all kinds of different stuff. So the idea is with the rhythmic stabilization, it's not just nobody gets anything out of that, right? So give him a chance to be successful. He will fail on some of them, but that's part of kind of how motor learning takes place. So as he gets better with it, we can work further away from the joint, give him a chance to be successful, all right? So that was rhythmic staves. Last 2 I want to show you, yoga push-up. Why don't we use you again? Yeah. You want to take your shirt off? Okay. We'll do it right on top of the table, so that way everybody can kind of see it. So when you do your push-up, go ahead and do like a couple push-ups for me, okay? Get to the top and just hold. Notice how the shoulder blades really haven't moved at all. Okay. What happens if we get them up into a little bit of a better core position? Immediately we see that there's a better change. So it's not just a matter of the scapula moving on the rib cage, it's a matter of the rib cage being in the right spot. So what I want you to do, we use something called a yoga push-up. And I want you to come on down. It's okay, let your scaps move as you do that. Okay. Now as you push up, push your hips up to the wall, up to the ceiling, I should say. Okay. So as we do that, notice how we're getting some of that good upward rotation we look for. You get kind of like this scapular upward rotation that we're trying to create. We get some good thoracic spine mobility. If someone is in a really heavily extended posture, we get them out of that extended posture. We create a good zone of apposition. And then as we come back down, we go right back into a push-up. Okay. Push yourself up, hips come away. And really learn to get those shoulder blades upwardly rotating a little bit more. So that's a very important thing on the device. We talk a lot about how important it is not just to balance our pressing and our pulling, right? But you got to balance your bench press with your push-ups. It goes beyond that because you have to make sure that you do the push-ups correctly. If your shoulder blades don't actively do anything and you're just going through motion of your humerus, you're not training that scapula to move on the rib cage the way that it should. So when we do our yoga push-ups like that, I want to make sure that people are getting to that upwardly rotated position, whether it's to actually shrug a little bit, whatever it may be. Obviously, get feedback if they're pinching, whatever it may be. That's a problem. But that makes some sense to you? Mm-hmm. Okay. So that was yoga push-ups. The cues are all in there. Last one is a standing one-arm cable row, and it's probably over there, so it's probably not a super important point to do. I have a video on YouTube called 8 Ways to Screw Up a Row. You guys may have seen it. Biggest things that I see with rowing are the humeral anterior glide. And this is a big one in boot camps when you get 30 people all doing TRX inverted rows at the same time, and everybody winds up here. So they wind up in scapular anterior tilt and then humeral anterior glide. And the analogy I use with that is it's like smoking a cigarette, right? You don't get lung cancer tomorrow, you get lung cancer 30 years down the road. So doing a row like that is you're hanging out on the anterior capsule, you're hanging on that biceps tendon, the nerves in the front of your shoulder. So when you keep doing that, people will wind up with problems eventually. So what I tell people, the quickest and easiest fix to that is bring the elbows out a little bit. Get them about 30 degrees of space between their arm and their side. And as a result, when you're out here, it's very hard to anteriorly tilt. In the process, they usually have to do more movement of the scapula on the rib cage as opposed to just being here. So we fixed a lot of rows just by bringing people to time it out, whether it's standing cable row, whatever it may be. Same thing happens with a chest support row when people wind up here. So just do monitor that. Just because you're doing rows doesn't necessarily mean that it's really helping. We're really emphasizing moving the shoulder blade on the rib cage instead of the humerus on the scapula. Questions on exercise? Sir?
Go ahead.
What's your opinion on the body blade?
Body blade? I think it's a good alternative to rhythmic stabilization. I think you're never going to beat the lack of predictability you get with rhythmic stabilization, but a body blade, a shoulder tube, whatever you want to call it, all decent options on the side.
With the row and keeping the elbows out, would you want to progress them as they got better at that to bring them more towards the side?
Not necessarily, because at the end of the day, I don't think we spend our life right here. We think about what actually happens. Why do we do that rows? It's so that we can be more comfortable up here. We can be in better position. So if we can actually get into a position where they're starting to have to worry about it, scapular upward rotation, I don't think we need to be doing here. But hey, baseball, stuff like that, that trains upward rotation just as much. So yeah, I don't think you need to necessarily be bringing them back in.
Sure. Doing something like a dumbbell row, how much are you looking for that, you reported that scapula to come all the way together? Are you looking for it to actually come all the way
I don't think they need to touch all the way together necessarily, because the other thing is we're monitoring like elbow excursion. So in order to get there, like your elbow's got to come all the way around. So dumbbell rows are a little bit tricky in that regard because it's hard to get your elbow off your side if it's like a bent over position. So I do think more of it needs to be scapulothoracic. But if you're cognizant of not allowing kind of excessive humeral range of motion happen, that scapula won't ever get to the spine. But it'll come close. So I think it is okay. I mean, you should have that movement in your arsenal. Other ones? All right, Dave.
I had a question. I don't know if this would be off topic, but when we were talking about just centrating in the
Yeah.
For just like the order of things that we do, if someone's having trouble centrating through, would it be beneficial to do a rhythmic state first, just to get?
I would do it last. Yeah. I would do positional breathing, and then I would do, basically T-spine mobility. I would spend time on scapular control, and then I would get to actually working at the glenohumeral joint with 90 ER holds, rhythmic stabilization, stuff along those lines.
Or even if they're having trouble just stabilizing through like a
Yeah.
supine rotation.
Exactly.
And they're bumbling through that, would you still say that?
You may, if they're having trouble with like a supine ER, you may need to modify their range. They may not be ready to be back here. They may need to be comfortable in the range that they've got. So I mean, it's no different than dealing with a guy after a surgery. You've got to progress him gradually. My biceps head just popped out when I did that. It's one of those things where you got to gradually reintroduce them to range that they need.
Okay.
So, sure.
On positional breathing, do you have a ratio or a count that you do with inhale, exhale?
I honestly, most of the time, we just program 5 breaths.
Okay.
5 in, 5 out, yeah. So like some of the videos on my site this week, like learning to exhale fully on like the deep squat breathing with lat stretch, or any of the positional stuff from earlier. I'll program that a lot more. Like we used to just say like 20 seconds, and guys are just like I'd rather have them like 5 big deep breaths in, 5 deep breaths out for that. But like on a bench T-spine mobile, we're gonna program it like set of 8 reps, exhale at the bottom of each.